If you're one of those dentists that needs to put a string of letters and credentials after your name, you're actually hurting your practice. I'm going to tell you why potential patients don't care about your bona fides when we get back. Thanks for joining me on this August 6th edition of the Patient Attraction Podcast. I'm Colin Receiver. First, I want to congratulate all of you who have achieved continuing education certifications. It takes a lot of hard work, it takes a lot of time, and you should, no doubt, be proud of yourself for whatever accreditations or certifications that you've accomplished. You're able to provide your patients with a higher level of care and more education as a result of doing so. Now, I need you to do yourself a favor and stop putting initials from each of those organizations or recognitions after your name when you're reaching out to potential patients. The only initials that matter to potential patients are DR. That's right, doctor. Here's why. The average person, the vast majority of people, don't even have an idea of the difference between a DDS and a DMD. So, taking that a step further, why do you think the other assortment of letters after your name increases your credibility at all when most people don't even know the most basic definition of a medical dentist versus a DDS, a doctor of dental surgery? This is a perfect example of dentist marketing to other dentists. I've made the joke many times that most dental marketing is more geared to attracting other dentists to their practice than it is to attracting patients. Unless you're trying to reach all the dentists in your community to work on them, those string of letter and numbers falls on blind eyes. So what's the problem with putting all those letters and numbers there? I call it the alphabet soup. The problem is that by putting them there, you think that you're establishing your credibility, and you don't do the things that actually do establish your credibility. Instead of advertising that you recently completed a rigorous process or course that includes continuing education for the rest of your professional life, you simply put AACD after your name, as if patients know what AACD stands for, or as if they'll actually bother to look it up. Now, I'm not saying that you shouldn't attend CE or not take advanced certifications. Quite the contrary. The more credentials they have, the more marketable you make yourself. What I am saying is stop relying on the alphabet soup of letters after your name to tell your story. It's not that easy. You have to promote the benefits of those letters to the potential patients that you're marketing to. How can you serve them better than someone else without those letters? That's what you have to answer. One final thought. Some dentists seem to think that because they've been to LVI or some other advanced course, that they're entitled to more patients than the kid who just graduated dental school down the road. I'm going to be blunt. You might be more qualified, but you aren't entitled to any more patients. You'll get as many patients as you earn. And if that kid down the road is promoting himself better than you are, he'll earn more patients. Come back tomorrow and we'll talk about how a customer's preconceived notions could help or hurt your ability to close more cases. Until then, keep moving forward.